What is the primary role of a certified phlebotomy technician? A. Diagnose patient conditions. B. Perform surgical procedures. C. Collect and process blood samples. D. Administer medications. Answer: C. Phlebotomy technicians specialize in drawing and processing blood samples for testing or donation. Which color tube is typically used for hematology testing? A. Red. B. Lavender. C. Blue. D. Gray. Answer: B. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as CBC. What does the term venipuncture refer to? A. Cutting a vein. B. Drawing blood from a vein. C. Giving an injection. D. Removing lymph fluid. Answer: B. Venipuncture is the process of accessing a vein with a needle to collect blood. What additive is in the light blue tube? A. Potassium oxalate. B. Heparin. C. Sodium citrate. D. EDTA. Answer: C. Light blue tubes contain sodium citrate, used for coagulation studies like PT/INR. What action should be taken if a patient faints during venipuncture? A. Continue drawing blood. B. Leave the room immediately. C. Stop procedure and notify medical staff. D. Pour water on their face. Answer: C. The procedure must be stopped immediately and the patient monitored until stable. What is the first step in performing a blood draw? A. Select the vein. B. Apply the tourniquet. C. Identify the patient. D. Clean the site. Answer: C. Proper patient identification is the first and most critical step to ensure safety. Which of the following requires strict aseptic technique? A. Glucose test. B. Cholesterol test. C. Blood culture collection. D. Hemoglobin test. Answer: C. Blood cultures must be collected with sterile technique to avoid contamination. Which location is most suitable for a capillary puncture in adults? A. Thumb. B. Heel. C. Index finger. D. Ring finger. Answer: D. The ring or middle finger is commonly used for adult capillary blood collection. The most common gauge needle used for venipuncture is A. 16. B. 18. C. 21. D. 12. Answer: C. 21 gauge needles are standard for routine venipuncture procedures. What is the purpose of inverting tubes after collection? A. Mix the additive with the blood. B. Prevent hemolysis. C. Promote clotting. D. Reduce air bubbles. Answer: A. Proper inversion ensures the additive mixes with blood to maintain sample integrity. What tube is used for a blood glucose level? A. Green. B. Blue. C. Gray. D. Yellow. Answer: C. Gray top tubes contain fluoride, which inhibits glycolysis and preserves glucose. What is hemolysis? A. Excessive clotting. B. Breakdown of white cells. C. Rupture of red blood cells. D. Low platelet count. Answer: C. Hemolysis refers to the destruction of red blood cells, which can affect test accuracy. How many times should a lavender tube be inverted after collection? A. 2 to 3 times. B. 5 times. C. 8 to 10 times. D. 15 times. Answer: C. EDTA tubes require 8 to 10 gentle inversions to prevent clotting. What causes petechiae during venipuncture? A. Using too large a needle. B. Excessive pressure post-draw. C. Tourniquet applied too tightly. D. Skipping antiseptic. Answer: C. Tiny red dots, petechiae, can appear due to ruptured capillaries under tight tourniquet pressure. Which blood sample is collected without anticoagulant? A. Serum. B. Plasma. C. Whole blood. D. Buffy coat. Answer: A. Serum is collected in tubes without anticoagulant, allowing the blood to clot. What is the function of the tourniquet? A. Sterilize the vein. B. Increase blood flow. C. Make the vein more visible. D. Stop bleeding. Answer: C. A tourniquet restricts venous return, making the vein more prominent for venipuncture. What PPE is required during routine blood collection? A. Gloves. B. Gown. C. Mask. D. Goggles. Answer: A. Gloves are required for protection from blood-borne pathogens. How should a used needle be discarded? A. Recapped and thrown in trash. B. Recapped and placed in sharps. C. Directly into sharps container without recapping. D. Soaked in bleach before discarding. Answer: C. To avoid injury, needles should go directly into sharps containers without recapping. What is the main concern with prolonged tourniquet application? A. Increased glucose. B. Clot formation. C. Hemoconcentration. D. Air embolism. Answer: C. Keeping the tourniquet on for more than 1 minute can concentrate blood components. What is the main risk of drawing blood from the basilic vein? A. Too small. B. Low blood flow. C. Close to major arteries and nerves. D. Difficult to locate. Answer: C. The basilic vein is near arteries and nerves, increasing complication risk. When is it appropriate to use a butterfly needle? A. When large volumes are needed. B. On newborns only. C. For fragile or small veins. D. For blood cultures only. Answer: C. Butterfly needles are ideal for small, fragile, or hard-to-reach veins. Which specimen must be chilled after collection? A. CBC. B. Bilirubin. C. Ammonia. D. Glucose. Answer: C. Ammonia levels degrade quickly and must be transported on ice. What should you do if blood flow stops during a draw? A. Withdraw needle and try again. B. Push needle deeper. C. Wiggle the needle. D. Tap the arm. Answer: A. If flow stops, stop the draw and attempt another site to avoid injury. What does QNS mean in phlebotomy? A. Qualified needle stick. B. Quality not specified. C. Quantity not sufficient. D. Quick needle sample. Answer: C. QNS indicates that the sample collected was insufficient for testing. What happens if a lavender tube is underfilled? A. Nothing. B. Test results may be inaccurate. C. Causes hemolysis. D. Blood clots. Answer: B. An incorrect blood-to-additive ratio can affect test accuracy in underfilled EDTA tubes.